Which one is the most orange? Oh, what the world? That's pretty frustrating, right? But you know what's not frustrating? Well, our new video is coming out here on YouTube. Now, here's a mini sample before we get today's lecture started. Fibrillation fireworks is the best way to remember VFib, the most deadly rhythm of all time. One of only two rhythms that you actually defibrillate or shock. Now, the other one is pulseless V-tach. So what is VFib? Well, ventricular fibrillation is a chaotic pattern of electrical activity in the ventricles in which electrical impulses arise from many different foci. Alright guys, before we get started, don't forget to do two things. First of all, subscribe right here so you can see all of our new videos coming out here on YouTube first before they get locked in our video vault at simplenursing.com. And also click right up there to your free demo to our new quiz bank, as well as 1,200 videos not here on YouTube. Alright guys, let's get our oldies webcam video started right here. Alright guys, so let's go over our leukemias. How leukemias, the pathophysiology behind leukemias, and what is the breakdown between really all of our blood cancers. So really, leukemia is really just talking about blood, cancer in the blood. So leuc comes from that white blood cell. Immature white blood cells, also known as blasts, there's way too much crowding out of blood cells. So what happens in leukemia is you have way too much production of blood cells itself. So inside of your bone here, your little bone, your bones are what creates your blood cell. So inside your bone, you have something that stems from your blood cell itself, your blood stem cells. And from this blood stem, you create white blood cells, you create red blood cells, you create platelets, and really just help your body to different functions of the body. So what happens in leukemia is we have an overproduction of white blood cells. Emia means condition of leuc, white blood cells. Leukemia, just too much white blood cells. It's almost like we reached full capacity of, let's say, too many policemen inside of our restaurant. So with too much policemen inside of a restaurant, you're really crowding out the production of any other type of blood cell. So we know that patients are in leukemia because you have an elevated WBC count that's really high. You have pressure being pushed on your bones. So you're going to have bone pain as well. You're going to have a decrease in all the other blood cells. So your platelets are going to be decreased. Your hemoglobin, hematocrit, is going to be decreased, as well as your red blood cells are going to be decreased production because you have way too many white blood cells being produced and a lot of bone pain as well. So let's get into the different kinds of leukemia and let's break it down. So with our leukemia, we really have four classes of leukemia itself. You have what's called acute myelogenous leukemia, and you also have chronic myelogenous leukemia. Really just depends on where and which blood cells are being produced at a faster rate. So, in our blood stem, these stem cells, we really just start with one blood stem cell. It's almost like a production plant for all your different types of white blood cells. If you have an overproduction of myeloid stem cells, this is what we call acute myelogenous leukemia, okay? What's also known as AML. AML. You can also have a chronic myelogenous leukemia. Just saying that acute means it happens rapidly. Your white blood cells go up very rapidly and over the course of, let's say, a few days. With chronic myelogenous leukemia, you have an overproduction of these myeloid stem cells over the course of, let's say, a week, let's say a few months, and you have a creeping up of these WBCs. Acute means it happens rapidly, okay? So your patient's going to present with low H&H, low hemoglobin, low hematocrit. Your patient's going to present with low platelets. Your patient's going to present with high WBCs. A lot of bone pain inside of this bone marrow, okay? So your patient's going to look pale because we have a low H&H now. Your patient's going to probably have hematomas, or basically bleeding from anything because of that low platelet count. We're also going to have this high white blood cells. So on the other hand, if the problem starts with your lymphoid cells, it can be as the same thing, a chronic issue or a acute issue. So we call this acute lymphoma, a lymphocyte leukemia, or chronic lymphoid leukemia as well. So really the difference is, where is the site of origin? Where is it being produced? In your lymphoid stem cells or your myeloid stem cells? And is it a chronic issue over the course of a few weeks to months? Or is it an acute issue over the course of a few days? Let's see here. One thing to know, and nursing tests love to put this on the test, is that CML, this one right here, has a specific test. Our chronic myeloid leukemia has something called the Philadelphia chromosome. Philadelphia, the city of brotherly love, right? Not really feeling it right here. So the Philadelphia chromosome usually is an indication of chronic myelogenous leukemia. For your ALL, your acute lymphoid leukemia usually happens with pediatric patients. For some unknown reason, always 9 times out of 10, chronically, acute lymphoid leukemia is with those pediatric patients, okay? So, it is idiopathic. Idiopathic means that we are idiots in terms of the pathophysiology. We don't know why this happens. It's idiopathic. That's just a nice way of saying, in the medical field, we don't know why it happens. We're going to treat the signs and symptoms and the condition now. So, if a question in terms of your nursing test comes up and says, your patient has a question of the causes of these leukemias, it's idiopathic. We don't know, okay? So for some clinical manifestations of leukemia, let's go into that next, and let's break down some clinical manifestations. We kind of touched on it, but let's break it down even a little more here, okay? Alright guys, thanks for watching only one part in our full video here at simplenursing.com. If you guys click the link right here, you can get access to our full course, as well as our new quiz bank, which is really nifty. And also guys, don't forget to subscribe to our YouTube channel right here. And last, but definitely not least, a big thank you to our script team and nursing family who helped us put together all these nifty videos.